everybody. Thank you so much for joining us here today for this session on Disrupt Disparities. I'm going to be sharing my screen with you, and I'm Beth Finkel, and I'm really pleased to be joined by Aaron Tax from SAGE, Michael Adams, also the head of SAGE, Dr. Nee Cordelai-Corte from AARP Multicultural, Bill Rivera, who is with the AARP Foundation, and Lisa Krinsky. So I want to thank you all for joining us. I'm going to get right into the program because there's so much great information that we're going to be sharing. And I want to make sure that we have time for everyone to speak and also to get all of your questions in conversation. So I'm going to be sharing right now. And so I thank you all for joining us. And back up here. So this is a partnership that we did between SAGE, AARP New York, and the AARP Foundation. And we all came together because I think we were identifying each in our own sectors of that there was so much inequity when it came to 50 plus LGBTQ New Yorkers. I think it's also indicative for the country, but we're just speaking for New York right now. Nearly 1/3 of LGBTQ New Yorkers are over the age of 50. And although a key part of New York State's rapidly growing elder population, LGBTQ people, remain largely invisible and I'm sorry, hearing some echo, and face and face a lack of legal and social recognition. And so much of this is just rooted in just plain discrimination at all levels. And it affects how they're reliant upon their nuclear family to get inclusive services, and how other social determinants of health and well-being are so affected by how systems react and approach. Sorry, I'm told that I need to expand this to the full, so I'm not sure.
Beth, at the very bottom of the screen on the right-hand side, you'll see a little thing that looks like a screen to the left of where your thing is, a little bit left to your point, where your pointer is, and you press on that thing. It looks like that thing, yep.
Oh, perfect. Thank you. Okay. So because of all of these problems, that again, that lack of legal and social recognition, the reliance on chosen family, all of these things really affect how older LGBTQ New Yorkers face their lives and how they can overcome the challenges. And these disparities are very often compounded and even greater for the estimated 1 in 5 LGBTQ New Yorkers who are people of color. So this report is going to be broken down into 3 areas. One of them is economic security, one is healthcare, and one is caregiving and social connections. And I'm going to break into a short video that I think is going to give you some of the background of what we're trying to share with you today.
Nearly 1/3 of LGBTQ New Yorkers are over the age of 50. This is the Stonewall generation. They are the trailblazers whose resilient and dynamic leadership sparked the LGBTQ movement and the fight for social justice. Yet they remain largely invisible, and many of the disparities they face are still rooted in the same discrimination that started the movement decades ago.
The numbers are disturbing. 23% of LGBTQ New Yorkers of all ages cite inadequate insurance coverage as the most significant barrier to health care. And 1/3 of LGBTQ 50 plus live at or below 200% of the federal poverty level. Because many LGBTQ 50 plus people live alone, 21% have provided caregiving to their friends, and that is 3.5 times what their non-LGBTQ peers provide. And 8 out of every 10 LGBTQ 50 plus would feel much more comfortable with healthcare professionals who were trained in LGBTQ patient needs. Training that is now lacking in our current healthcare system. It's time for change.
However, disparities pose challenges as LGBTQ New Yorkers seek inclusive healthcare, economic security, and housing. Social isolation is especially prevalent since LGBTQ people are far more likely to live alone and less likely to have familial support systems. The pandemic has created even more isolation and inequity.
The inequities that LGBTQ New Yorkers face in health, in livable communities, in economic security, in social connection and caregiving stem from a lifetime of discrimination. We must and we can come together to build and provide equitable solutions that improve the lives of older LGBTQ people.
It's imperative, especially during the current pandemic, that LGBTQ New Yorkers do not get left behind. They need to have the same access to vaccines and basic needs as everyone else. Healthcare, especially now, should be inclusive and accessible. New York's leading organizations that advocate for the LGBTQ community are working together to outline the situation and propose clear solutions. Our latest chapter in the Disrupt Disparities series shines a light on the harsh reality of these disparities facing LGBTQ people of all ages, especially people of color, but it also offers real solutions.
LGBT older people are extraordinarily resilient, and at the same time, they face tremendous disparities and challenges. That's why SAGE is so proud to be partnering with AARP, the country's leading champion for older Americans, to decisively address the needs of LGBT older people with this groundbreaking report.
By analyzing social, health, and economic issues from a culturally aware perspective, legislators can find effective answers for a population that's been discriminated against for far too long. You know, the COVID-19 pandemic has laid bare the unconscionable health and financial disparities that are made more difficult by the racial identity, sexual orientation, and gender identity of older New Yorkers. That's why I'm proud that AARP New York, the AARP Foundation, and SAGE have joined forces to develop the Blueprint for Action. Local, state, and federal leaders from New York have the potential to offer the nation examples to narrow some of the most persistent LGBTQ health and wealth disparities in these challenging times.
Oops. Sorry. Okay. So I'm going to go into a little bit more of the detail here, and then it's going to be followed by the panel, who are each experts and are going to be able to even go into more depth and answer your questions, and also a vision for going forward here. So I'm going to start off with the bucket around economic security. And as you can see on the slide, it was previously said, and this is really the base of where all the problems begin to lie, which is, you know, if you don't have economic justice, if you don't have equity, then every decision that you make in life is made within that lens of what you can afford to pay for. So 1/3 of LGBTQ 50 plus live at or below 200% of the poverty level. That's compared to just 1/4 of non-LGBTQ people. So that's a huge difference. So as I said, when people have fewer financial resources, they are more likely to not only live below the poverty level, but also make all those decisions related to that. So housing options are more limited. Healthcare options are more limited. But just in housing alone, LGBTQ are much more likely to face discrimination, even if they're living in a senior living community. And many have a history of housing insecurity or homelessness, and also having this feeling that they can't come out of the closet. And if they've been out of the closet all their lives, when they're in these a lot of the senior housing developments, they feel they have to go back in again, which is kind of unbelievable to have to contemplate in your older years, that you can't be your authentic, true self. Now, when we look at healthcare, 23% of LGBTQ New Yorkers of all ages cite an inadequate insurance coverage as the most significant barrier to healthcare. Well, I think we can all understand that. In our times, we've been grappling with how to make healthcare more affordable. But when you think about it for LGBTQ people who are much likely to live below the poverty line, you can imagine how all the decisions around healthcare are limited. And don't forget, it's not just physical healthcare, it's also mental healthcare. And then there's a concern about the competency of the healthcare that they're receiving after experiencing this lifelong discrimination. So these disparities include rates of disability, poor physical and mental health, alcohol and tobacco use, and HIV. Many of these health disparities put LGBTQ older people at even a greater risk for experiencing COVID-19 more acutely. And then we're going into the bucket around caregiving and social connection. This is also around isolation. I know we're all hearing a lot about isolation, especially here about it today at ASA. But because of these thinner support networks that LGBTQ people have, they are more at risk. As a matter of fact, 21% of LGBTQ people 50 plus have provided care for friends. And that's compared to only 6% of non-LGBTQ peers. And that goes back to what we talked about previously about your chosen family. And how do systems bump up against your chosen family? How do they mesh with your chosen family? All of that is much more challenging for LGBTQ people. And because they have this thinner support network, they're much more likely to live alone. They are far less likely to be able to rely on adult children or other family members. There's a greater chance that they actually have not had children in their lives. And they may or may not have a spouse in their later years. So they can't rely on family members. They have to rely upon their own social networks. And sometimes that can be very, very difficult. So social isolation is very, very hard for them to overcome. And just a quick aside, the AARP Foundation has been doing a lot of work on isolation. And we know that being isolated actually is the equivalent of smoking 15 cigarettes a day. And that goes right back to what we talked about around the health disparities. They just get compounded and make people more likely to get other diseases and fall ill. So to help ensure that 50 plus LGBT New Yorkers have more choices as to how they can age and how well they can age, this report, and this is the part I think I'm most proud of about this report, is that we have very hard, concrete policy recommendations that can be adopted by public officials. And I just have to say that when we launched this report, and many of the people that are on this presentation with me today were there for the launch, I don't remember a time that I called on New York State legislators to come to a launch event, especially during COVID, on Zoom, where so many of them showed up that we were afraid that we wouldn't be able to give them, all these legislators, time to talk about why this is important to them. And every single one of them made a firm commitment to the recommendations that you're going to hear in this report. And following the releasing this report, we had commitments from legislators actually calling us after the report saying, I want to be a sponsor of this. I want to be a sponsor of that. I want to be the one that shepherds this through the Assembly. I want to be the one that shepherds this through the Senate. And the governor's office was immediately receptive. And their Office of Diversity got very involved also. So we're very excited about this. And I should have said in the New York State Office for the Aging, led by Greg Olson, also already started to tackle many of these recommendations. So I'm going to take you through the recommendations now. I know that they're a little wordy. I put some of them on the slides. I didn't put all of them on because honestly, they'd overwhelm you. They're all in the report, but I'm going to try to go through them as quickly as possible as I can, okay? So the first one is we want to formally designate LGBTQ older people and older people living with HIV as groups of the greatest social need under the Older Americans Act. I think that's understandable. That's where dollars flow. That's where policies flow from. We want to establish a standing commission on LGBTQ aging to identify challenges, share best practices, develop recommendations on ways to improve the quality of life of 50+ LGBTQ New Yorkers. We want to create a task force to review how family is defined in New York State through our laws and policies, and we want to make sure that the definitions are fully inclusive of families of choice. We want to update the New York State Office for the Aging's Equal Access Guidance to explicitly prohibit discrimination based on gender identity or expression and provide additional guidance. We want to adopt a comprehensive caregiving law with an inclusive definition of the caregiver. We want to adopt an LGBTQ long-term care residence bill of rights. Again, we don't want people to have to go back from where their authentic self is, that they have to hide who their true identity is, especially in later life. I can't imagine anything more hurtful. Establish an independent long-term care task force to really look at long-term care systems across a whole broad systems across New York, not just institutional, but also home and community-based care. We want to mandate a minimum level of LGBTQ cultural competency trainings for state-funded providers. We want to expand LGBTQ programming and targeted outreach to LGBTQ. And then finally, I just want to talk a little bit about the systemic collection of analysis and reporting on LGBTQ inclusive demographic data. We really must add LGBT inclusive questions to every form where other demographic information is already captured, such as age and race. When those are asked, we should be asking about gender also. We also want to ensure that COVID-19 surveillance efforts and patient records capture the sexual orientation and gender identity as part of routine demographic information. And we want to develop a strategic plan and timeline to expand the LGBTQ inclusive data collection to all New York State data systems. So that's all those intake forms and all the survey instruments and the needs assessments. And finally, we want to be conducting regular assessments of the needs of older LGBTQ New Yorkers and ensuring that LGBTQ older people are represented in broader community needs and assessments. I think you heard me say previously, the time is to act is right now. I think we got that message across to our government representatives and administration. And again, I can't tell you how excited I am by the response that we've gotten. I've never seen this response before. So I think the time is now and we're going to capture it. So I'm going to hand the mic over to Bill Rivera. And I'm going to stop the share. And yeah, thank you so.
Great, thank you, Beth. Good afternoon or good night, depending on who you are or when you check. I'm Bill Rivera, Senior Vice President for Litigation at AARP Foundation. AARP Foundation is a parent affiliate of AARP. They sponsor this wonderful conference. And I'm really
Bill, your screen is freezing.
Can you hear me? Are you hearing me? Can you hear me?
It sounds like you're talking through a blender.
Can you hear me this way?
Still very muffled.
Is
that better?
That seemed slightly better.
Lava, yours is also garbled now.
Oh,
I can hear you. Can you hear me?
Yours is also garbled now.
Oh, okay. If I could make a recommendation,
That's better.
I think that Bill's connection might be garbled. I'm wondering if we could return to Bill.
I'm wondering if we could return to Bill.
I will try to leave and come back.
While Bill's doing that, I'm happy to jump in and ask myself the first question and answer it too. How about that? All right. So I will ask myself, why is it so important to collect sexual orientation and gender identity data? Well, funny you should ask, because I have an answer. There's a few things I want to point out. First of all, why it's so generally important. I think we can think back to the refrain that you'll often hear in the LGBT community, which is, if we are not counted, we don't count. And what that means in a nutshell is, think about making policy. And if we have no data on LGBT older people, it's impossible to figure out what the interventions might be to address some of the needs of this population. So if we're not counted, we don't count in terms of policy making. That's at least the lens through which I see this. And if you want to have an example of what this could mean, in the healthcare space or in the aging space, you can think about, even COVID-19 and how about, and all the data we're seeing these days on the disproportionate impact of COVID on Black communities, people of color, and people of all sorts of intersections. And one thing we're not hearing a lot about, unfortunately, is the specific impact of COVID-19 on LGBT populations. We certainly have a lot of anecdotal data. We have a lot of stories we can share about the impact on our population. But if you're asking about vaccine rates or death rates or any of the hospitalization rates, some of these nuts and bolts numbers, we don't really have them with respect to LGBT folks. With the caveat, there are some states who are collecting this data. And the consequence of that is it's hard to design interventions in order to reach LGBT older people. Again, we have a little bit to go on. We can talk about the anecdotal stories that we hear, the clients that we serve at Sage, the clients that are served at Fenway, and other places. But think about how much better our interventions could be and our policies could be if we had the full picture of the impact of COVID on LGBT older people. So that's a general frame of why this data is so important. I'm going to point out two things rather briefly that are on our radar in terms of data collection at the national level. The first thing I'm going to point out is the National Survey of Older Americans Act participants. This is a survey that's been around for some time, and it measures the efficacy of the Older Americans Act in meeting the needs of the people who are most vulnerable in our country. President Obama added an LGBT demographic question to that survey. And the one and only question that the Trump administration tried to remove from the survey was the LGBT demographic question. We and many others on this call pushed back and successfully got the administration to re-include the lesbian, gay, and bisexual question, but they did not include the transgender question. So one of our top priorities for the Biden administration is to re-include the transgender question. I will flag right now through early May, there's actually a comment period at the Administration for Community Living where people can weigh in and share their thoughts on why it's so important to re-include the transgender question. So we're certainly hoping AARP, a lot of other folks on this call today will weigh in that comment period and talk about why it's so important to have that transgender data at the national level. In addition to that, there's a new data requirement coming out under the Older Americans Act language that passed just this past March. For the first time ever under the Older Americans Act, there's now a requirement that every single state unit on aging and area agency on aging must collect data on the needs of LGBT people they're serving, collect data on whether they're meeting their needs, and engage in outreach to that community. And we're looking forward to some comment periods on that, where we can all weigh in with the Administration for Community Living about how that law needs to be implemented. So I think I'll pause there and turn it back to Bill if you're back on, or whoever's going to be moderating this session. But I'm happy to take any questions about the importance of LGBT data collection later on in the program.
With Aaron while we're hopefully waiting for Bill to come back and join us. So hello, everybody. I'm Lisa Krinsky. I'm the director of the LGBT Aging Project at Fenway Health in Boston. And I wanted to just talk briefly about, we've talked about the importance of data, but also to talk a little bit about the distrust in our community around this data and how we build some of that trust. And I think it's so important because we have to remember that for so many LGBT older adults, their sexual orientation, their gender identity and expression, that demographic data has been personal information that they have spent a lifetime protecting, and that they have considered that sharing that can put them at risk. And so even though we're coming at this from good intention and from the idea that we want, obviously, for folks to be providing this information, we also need to figure out how to make that safe for folks. And again, I sort of think of it in two ways. One is the content and about helping individuals understand, why is this information important? Why should I tell you this and answer these questions? How is it going to help me as a consumer if I identify my sexual orientation or my gender identity? And how is it going to help the organizations that are collecting that information? So really thinking first off about, why are you asking me this question? If I've called up to get Meals on Wheels, why does it matter whether I'm a lesbian? I just want Meals on Wheels. So helping understand the context for why that people are doing that. Again, also understanding who is asking the question. What are you going to do with this information? I think this is all that's important to be framed to folks. That is an explanation of, this is why we ask the question, this is what we do with it, this is how it helps us, and this is how it helps us help you. So it may be about connecting people to services and programs, understanding other affinity groups, understanding other resources that are available. And the other piece that I think has been important has been to make sure that the people who are asking the questions, if this is an interview question, that they are trained and comfortable in answering those questions. And that's a really critical piece, that we don't have people umming and ahhing and feeling all uncomfortable, because that sets a tone that says there's something awkward about asking these questions. And so that's a pretty key piece when we're thinking about how we build that trust, and then also how we get those messages out to consumers that says, this is where we're coming from. So one of the elder services agencies here in Massachusetts, when these SOGI questions were included in the standard questions, actually sent a letter out to their clients and introduced this and said, these are the questions we've added. This is why we're doing it. This is why it's important. And that was a message that was sent to all of their consumers. Heterosexual, cisgender, LGBTQ, everybody got the letter and everybody heard about how those questions were being asked. So that I think is an important piece when we think about how we work down some of that distrust and help people to understand the value of asking the questions and how it's important. I think I'll keep going then. I think we may have lost Bill. So the next question that I was going to talk about was this report and how it outlined equal access to inclusive programs. And I have to commend the work of AARP and SAGE, really wonderful comprehensive work that you did in looking at LGBTQ older adults in New York. And to say that, you know, in terms of what we've done here in Massachusetts, many of the things that we've been working towards are echoed in your report. We were able to include LGBT older adults as part of the Older Americans Act, so a population of greatest social need in Massachusetts. We did that in 2012. We established an LGBT Aging Commission out of the legislature in 2014, created a report with a broad range of findings, many of the things that you see in this report that you've added, and creating that sort of gathering and that collective group and making that an ongoing standard commission really has been an important, impactful one. The other thing that we did in 2018 is that we mandated training throughout the elder care network in the state of Massachusetts. So anybody who works with the State Union on Aging, contracts with them, anyone in that network is required to have LGBT cultural competency training. And the LGBT Aging Project was able to create that training module that's now being distributed across the network. But saying that regardless of where you live in the state, you should be able to encounter skilled and trained professionals who have some basic foundation about working with LGBTQ folks. And it shouldn't just be on the whim of which organization felt like they wanted to invite trainers in or do something like that. So I think that that was also a really important piece. I think some of the challenges that we found in building that, some of it has been around the implementation of the training. What we had not estimated at the beginning was that there would be 200,000 people in that network who received that training. And so thinking about sort of how to roll that out. And also understanding around the training that a 1 hour learning module is not a one and done. It's a beginning, but not that everyone will say, well, I took the training, so why do we have to talk about this anymore? We've accomplished our goal. That's setting the bar for folks. So I think that has been part of it. And then I think also creating the sustainability within the various departments that we're working with, public health, housing and community development, across networks and in individual organizations. I think a lot of the commitment to this work comes out of individuals who really take up the mantle and run with it. And we just want to make sure that it's sustainable so that when people leave those positions, that the work remains in the organization. So I'll stop there.
Okay, I think Bill is back with us now. So Bill.
I'm going to try. Can you hear me now?
Yes.
Fantastic. So this is what happens when you abandon your most newest and current technology for a 10-year-old computer. You seem to be able to make better connections. So I apologize for the delays, but my name is Bill Rivera, and I'm Senior Vice President for Litigation at AARP Foundation, and delighted to be here with such wonderful panelists and hearing both about the tremendous work that the AARP New York office led by Beth has done with our SAGE colleagues, as well as really trying to get at some potential solutions to working towards greater equity and justice in the LGBT space for low-income older adults. I wanted to jump in and just talk a little bit about some of the work that AARP Foundation is doing in this space, in addition to supporting efforts like the current report. And among other things, as AARP's charitable affiliate, we work to end senior poverty by helping vulnerable older adults build economic opportunity. And we do that by securing quality jobs, vital private and public benefits, and reducing their costs of living. And throughout our work, we are committed to increasing equitable outcomes to ensure that our solutions are not only effective, but also inclusive and just. And one of the things that I really love about working at AARP Foundation is that I have this unique privilege to run a public interest law firm under the AARP umbrella to advocate in courts throughout the country at the intersection of aging and social justice, including LGBTQ issues. So I just wanted to highlight some of the examples of cases that we have worked on, including some with Aaron and his colleagues at SAGE that are representative of our increasing commitment in this area. So for example, you are likely familiar with the Supreme Court's decision in Bostock. That was a case in which we filed a brief along with a number of other organizations, and the court held that Title VII of the Civil Rights Act protects employees against discrimination because of their sexual orientation or gender identity as discrimination on the basis of sex. We've also filed briefs in an Illinois case that held that a landlord is responsible for failing to address LGBTQ harassment by other tenants. We filed a brief in a DC case challenging the prior administration's regulation to exclude sexual orientation and gender identity from the Affordable Care Act's protections against sex discrimination in the delivery of healthcare services. And we recently filed briefs in a few cases on appeal that challenge as unconstitutional the denial of Social Security survivors' benefits, where the applicant was either not married or not married long enough to qualify for the benefits because state law unlawfully prohibited same-sex marriage during the course of their longstanding relationship. So I'm really grateful to have the support of AARP CEO Joanne Jenkins and AARP Foundation President Lisa Marsh Ryerson, who saw in the video earlier, for having the commitment to expanding our work into ensuring that we are protecting LGBTQ populations as well as we protect the civil rights of other older adults. It's really so great to be with this panel, and so I want to turn it over now to my frequent partner in crime, Nicolai Corte, who has really been just a tremendous champion in this area for us, and he's recently stepped up to lead our multicultural engagement for the AARP COVID-19 vaccine education campaign to help blunt the racial disparities being exacerbated by the national vaccine rollout. So perhaps, Nicolai, you can tell us more about that as part of your conversation.
Sure. Thank you, Bill, and good afternoon, everyone. I just really want to applaud the efforts, the collaboration really between AARP Foundation, the AARP New York State Office, and SAGE, among other partners in developing this research. Bill knows this, and most everyone that I work with on this call knows that I often say no data, no justice. No data, no justice. And if you all leave this session with any one thing in particular, I think that's a through line that you've heard in the remarks shared by Aaron, by Lisa, and Bill. This report is long overdue. It's a long overdue contribution to what is now a growing canon of LGBTQ research. It really offers us insights that help us to develop diversity, equity, and inclusion rooted strategies and solutions that make LGBTQ older adults more visible. We had a chance to work together some years back on the Maintaining Dignity study that highlighted some of the challenges we saw among LGBTQ older adults on issues related to culturally competent care, affordable housing, social isolation, and data collection. And I think the COVID-19 pandemic has really shined a light on those inequities, on those challenges that have been pre-existing. And so what I'm really excited about in terms of this report is the opportunity to use it as a movement building tool. It does such a beautiful job highlighting a lot of the challenges, but also the solutions. These recommendations, some of which Beth went over at the top of this presentation, are within reach. They are possible, and these insights have the possibility to drive some of our funding decisions, some of our budgeting decisions, how we evaluate our work moving forward. This report is rich with insights, make no mistake about it. And it's really great to see the health and economic impact of LGBTQ folks being recognized in this report. But I just want to sort of pull apart for a second the L, the G, the B, the T, and the Q. This report recognizes that each letter in that acronym represents some distinction, represents some unevenness, represents a different spin on the challenges that we see impacting LGBTQ older adults. And so, I'm really excited that we get to use this as a blueprint as we continue to find our way out of the wilderness in this COVID-19 pandemic. And hopefully one day as we begin to seriously talk about recovering from this COVID-19 pandemic, this report offers us a blueprint, and we would be wise to really dig into it.
Great, thanks, Nicordelai. And I really love that expression, and I have borrowed it liberally of no data, no justice that Nicordelai mentioned. I think it really is a wonderful and common theme, and it has really benefited us in our advocacy. Just as a direct example, our ability to cite to studies that AARP did in 2018, the Maintaining Dignity survey that Nicordelai mentioned, as well as our multicultural work and jobs study in 2018 as well, enabled us to be able to talk about what some of the practical consequences of being an LGBT older adult were in the context of cases that we were looking to participate in. So, for example, it's helpful for us to be able to share with courts and others that there are approximately 900,000 AARP members who self-identify as LGBT, which makes us one of the largest LGBT constituencies for any US organization with a membership. And to be able to talk about 1 in 5 older LGBT adults reporting recently having involuntary job loss due to, at least in part, their perceived sexual orientation and gender identity, and the postponement of retirement at a higher rate than the general population, and some of the data that we saw come through in the New York Disrupting Disparities report. So really the importance of having something you can point to in the data to demonstrate the importance of the issue as well as to inform possible solutions is really tremendous. And I want to turn now to a wonderful colleague and partner in so many of the items that we work on in this space, CEO of SAGE, Michael Adams, and then we'll have some closing conversations. But Michael is the CEO of SAGE, which is the world's largest and oldest organization dedicated to improving the lives of LGBT older people, and really a true civil rights champion. So it's my pleasure to turn it over to you, Michael.
All right, thank you, Bill. And I'm really only going to speak for a minute or two so we can get to the questions. I'm really pleased that so many folks have joined us for today's program and discussion, and for this really great panel. The discussion we're having today is really a thought-provoking conversation about the challenges and resiliencies that LGBTQ older folks have. It's a dialogue about equity, about data, about policy advocacy, about challenges building LGBTQ inclusive strategies, about where the pandemic fits into the mix, and disparities in COVID-19 vaccine access. But this is also, and I think Nicordelai has really underlined this is also a story about the power of collaboration to achieve transformative change. And in fact, part of what makes this initiative and its early success so unique and so important is this really strong partnership that anchors the work. It's a partnership that includes SAGE as the country's oldest and largest organization, working on LGBTQ aging issues. That includes the AARP Foundation, a national leader dedicated to serving vulnerable and isolated older people, and AARP New York, which champions older New Yorkers and helps them to lead their best lives. And in particular, I really have to give a huge shout out to Beth Finkel and her amazing team at AARP New York for their extraordinary leadership and expertise in the New York State advocacy arena, which clearly has been and continues to be an essential part of the secret sauce that is making this project work so well. And Beth, when I think about the first time you and I had lunch way back when, and talked about this concept, it's just so thrilling to see where it's gone. And so much of that is about your leadership. And so we're so grateful for that. Also, thanks to the vision and leadership of the AARP Foundation under the incredible guidance of Lisa Marsh Ryerson and her extraordinary team, this initiative, while it launched in New York, has tremendous potential for national impact. And based on the success of just the first few months, in terms of both policy progress and public attention, already AARP state offices and SAGE affiliates and others in numerous states across the country are expressing strong interest in replicating this disrupting disparities model, which is really, really exciting. So even as we continue to push energetically for policy breakthroughs in New York, we're already looking to leverage disrupting disparities to build truly national impact for LGBTQ older people. Now, of course, every state is different, and opportunities for progress on behalf of LGBTQ older folks may be more constrained and are more constrained in some parts of the country than in others. But the reality is the broad mix of strategies and recommendations that are encompassed in the Disrupting Disparities initiative launched in New York really ensures that this initiative can be adapted and tailored to work effectively in any state across this nation. Now, also, I want to underline what Nikolai mentioned as well, that as we expand the impact of this initiative nationally, we really also look to build on that strong intersectional lens contained within the New York project, which shines a very powerful spotlight on how LGBTQ elders of color are at multiple disadvantages because of race and ethnic disparities and discrimination that are layered into the disparities based on sexual orientation and gender identity. So with that, that's really all I wanted to share, and just underline again the power in this collaboration and the leadership that has been displayed by AARP New York and AARP Foundation and your extraordinary leaders. So with that, Bill, let me pass it back over to you. Thank you.
Great, thank you, Michael. And I really love your highlighting the intersectional challenges that come with this. If you are older and you are female and you are Black and you are LGBT, you've got a lot of different things that are going to have the potential for impacting how you live, where you work, where you live, how you work, what your opportunities are. So Nicola, I actually wanted to come back to you a little bit on that as somebody who really has been a leader in a number of different capacities on both racial equity as well as LGBT discrimination issues. Any sort of observations you have off the top on that intersectional lens that Michael was just talking about too?
Yeah, thank you, Bill, and thank you, Michael, for your leadership and the leadership of everybody at SAGE. I think it's sometimes we've got to recognize there's a difference between equity and equality. And I think sometimes those terms are used synonymously in error. People mean well, but those terms mean something different. And I think part of what this report is offering to leaders in New York and really leaders across the country and around the world is an opportunity to lean into addressing these disparities with a consciousness around equity and recognizing that there is an unevenness in terms of how different constituencies under the rainbow are impacted when it comes to healthcare and employment and housing and all the other social determinants of health. And so, I really mean it when I say that this report offers a blueprint that is going to help us really narrow and, dare I say, eliminate these disparities, as opposed to exacerbate these disparities. Sometimes when we take a one-size-fits-all approach to all the different constituencies under the rainbow, sometimes there are unintended consequences there that we have to live with. And so that's my high-level observation that I'd like to share for the sake of time.
Said, and that distinction between equity and equality is one that we will see play out in a number of different ways as many organizations try to be much more purposeful and conscious and explicit about thinking about equity and equality in the work that they do in the future. So I think those are important distinctions and items to keep track of and distinguish as you suggest. We only have 5 minutes left, so I want to give each person an opportunity to close by sharing something that you are optimistic about in 2021, given what we're learning, the recommendations in the report. It shines a light on the disparities impacting the LGBT community, and as Beth highlighted, some of the potential solutions. So why don't I start with you, Lisa, about something you are optimistic about?
Excuse me, thank you. And thanks to all of you for including me in today's conversation. Without sounding terribly Pollyanna-ish, I think the sense of resiliency, I think sometimes when even framing this as disrupting disparities, we talk about the negatives that many people are encountering, and they are definitely real and they're out there, and those are challenges. But we've also seen tremendous resilience and strength and mobilization, and even the fact that in this pandemic, we've kind of learned that geography sort of is a little more amorphous as we can connect via Zoom. And so I think what I'm positive and hopeful about is our abilities to really take this information, the disparities we see, and craft possibilities for creating better, more equitable, inclusive ways for LGBT older adults and those of us who are emerging older adults will move forward in the world and will be able to have voices and visibility and advocacy to create the kinds of environments that we think that everybody is due to live with in their lives.
Thanks. I love that sense of positivity and hope. Aaron, how about you?
I think the thing I'm most optimistic is now we finally have an administration that actually sees LGBT people, knows we exist, and understands the importance of recognize that, at least in terms of making policy for a change. So I'm optimistic about what we can do together with the Biden administration.
Great. Beth, how about you? You're going to take this show on the road and help our colleagues expand this, as Michael was suggesting, or other thoughts?
I think that's exactly where my brain was going, that, we've already seen the great work of Massachusetts, and I thank Lisa for sharing that. I think AARP, the AARP Foundation, and SAGE have just such a natural both gravitas in this area and the political will to move this forward. So I'm really excited. I know a number of our other states have already raised their hands and said they want to jump in and try this and make changes in their state. So I'm very excited and very optimistic about this. So thank you, Bill. Thank you.
I am too. Michael, closing thought from you on optimism.
Yeah, I think what I'm optimistic about is our ability to learn and build on efforts across the country. Just a few days ago, the Commonwealth of Virginia designated LGBTQ older adults as a population of greatest social need. When I think back on when Illinois became the first state in the country to do that legislatively back in 2018, it was such a huge breakthrough, and we've seen since then a number of states follow in those footsteps. And to Beth's point, that's what we're going to do here as well, right? Learn from each other, build on what we've already accomplished in one jurisdiction, and take it more broadly to build impact. So I'm very optimistic about that.
Great, thank you, Michael. Nicordelai, how about you?
What gives me hope, riffing off of what Aaron had shared earlier about the new administration, what gives me hope is specifically the racial equity executive order. I actually think that was a pretty significant moment for our movement. An administration that offered an operational definition of what they mean by equity that was inclusive of race and gender, sexual orientation, and gender identity. And seeing this administration sort of challenge the federal government, to do a review and assess how well we're doing against an operational definition like that. And I think just the power of that EO to influence even private industry to take stock of how well they're doing and what they can do better. And so I think it's just another example of how this LGBTQ Disrupt Disparities report is meeting the moment. And I look forward to what becomes of it.
Thanks, Nicordelai. Well, I have to say, for me, as the father of a 20-year-old and 17-year-old daughters, that I am optimistic about the intergenerational nature of the support for paying more attention to equity for LGBTQ individuals. It is something that is inspiring to see my kids take up that mantle as well in their broader sense of social justice. And so I am optimistic that the next generation will do an even better job than we have, and continuing to fight the good fight on behalf of everyone. So with that, I want to thank all of my colleagues here today for joining us. Please visit the AARP Foundation and SAGE exhibit booths and check out everybody's bio. I know we didn't have a chance to fully go through those, but information is there, contact information is there. Network and enjoy the rest of the conference. Thank you.
Thank you.